Is frequent urination a problem? Here's what you need to know. Frequent urination, medically known as urinary frequency, is a condition where an individual feels the need to urinate more often than usual. While the average person urinates about 6 to 7 times in a 24-hour period, peeing more frequently can be influenced by various factors, including fluid intake, lifestyle habits, and underlying medical conditions. Understanding the potential causes and when to seek medical advice is crucial for managing and addressing this symptom effectively. In this video, we're diving deep into the real reasons why you might be peeing so often, from the harmless to the serious, and what you can do about it. 1. Weak pelvic floor. One of the most common yet under-discussed causes of frequent urination is a weak pelvic floor. The pelvic floor is a network of muscles and connective tissues that supports the bladder, uterus, in women, prostate, in men, and bowel. These muscles help control when and how we urinate. When the pelvic floor becomes weak or compromised, it can affect your ability to hold urine, leading to leaks, urgency, and a need to urinate more often. Pelvic floor weakness often develops over time. In women, childbirth, especially vaginal delivery, is a major contributing factor, as it stretches and sometimes injures the pelvic muscles. Men can also experience pelvic floor weakening, particularly after prostate surgery. Aging, obesity, chronic coughing, constipation, and lifting heavy weights can all strain the pelvic floor and contribute to dysfunction. As these muscles weaken, they can't properly support the bladder or control the urinary sphincter. This can result in involuntary urine leakage, a feeling of incomplete bladder emptying, or the sensation of needing to go again right after you've just been. Fortunately, pelvic floor therapy, including Kegel exercises, can strengthen these muscles and restore bladder control. Recognizing this as a potential root cause is the first step toward effective treatment. 2. Painful bladder syndrome, or interstitial cystitis. Painful bladder syndrome, also known as interstitial cystitis, is a chronic condition that causes bladder pressure, bladder pain, and sometimes pelvic pain. What makes interstitial cystitis different from a typical bladder infection is that it isn't caused by bacteria and doesn't respond to antibiotics. Despite this, the urge to urinate frequently, sometimes every 20 to 30 minutes, is a hallmark symptom. The underlying causes of interstitial cystitis are not fully understood, but many experts believe it involves a breakdown in the protective lining of the bladder, allowing irritating substances in urine to inflame the bladder wall. This inflammation triggers a persistent sense of needing to urinate, even when there's little or no urine in the bladder. For people with interstitial cystitis, urination doesn't bring relief. It can even increase pain. As the condition progresses, people often limit their activities, avoid long trips, and struggle with disrupted sleep due to nighttime urination. Managing interstitial cystitis typically involves dietary changes, physical therapy, bladder retraining, and medications that soothe the bladder lining. Although it is chronic, symptoms can be managed once the right diagnosis is made. 3. Kidney stones. Kidney stones are small, hard deposits made of minerals and salts that form inside the kidneys and urinary tract. While they're notorious for causing sharp, intense pain, especially in the lower back and groin, they can also cause you to urinate more often than usual, particularly as they move down toward the bladder. As kidney stones travel through the ureter, they can irritate the urinary tract, mimicking the feeling of a full bladder. This irritation triggers the bladder to contract more frequently, creating urgency even when very little urine is present. For many people, this frequent need to urinate is accompanied by a burning sensation, blood in the urine, or difficulty passing urine altogether. Dehydration is a major risk factor for kidney stones, as concentrated urine allows crystals to form more easily. Diet also plays a role. Foods high in oxalates, sodium, or animal protein can increase risk. If you're peeing often and experiencing pain, it's essential to rule out kidney stones through imaging tests. Fortunately, with proper hydration, dietary changes, and in some cases, medical intervention, kidney stones can be managed or prevented. 4. Neurological disorders. The nervous system plays a central role in controlling bladder function. When neurological communication between the brain and the bladder is disrupted, it can lead to a condition known as neurogenic bladder. This often results in symptoms like urgency, frequency, and sometimes incontinence or retention. Neurological disorders such as Parkinson's disease, multiple sclerosis, spinal cord injuries, and even strokes can affect the nerves responsible for bladder control. Depending on which part of the nervous system is impacted, the bladder may become overactive, sending signals to urinate frequently even when it's not full or underactive, making it hard to know when to go. People with neurological conditions often face a variety of symptoms beyond urinary issues, but managing bladder symptoms can significantly improve quality of life. Treatments include medications, catheterization, nerve stimulation therapies, and physical therapy focused on strengthening control. 5. Vaginitis. Vaginitis refers to inflammation of the vagina, typically caused by infections such as bacterial vaginosis, yeast infections, or trichomoniasis. While the primary symptoms involve vaginal discomfort, unusual discharge, and itching, many women also experience frequent urination as part of the condition. This happens because the inflammation and irritation from the vaginal infection can affect the urethra, which lies in close proximity to the vagina. The urethral irritation causes a persistent urge to urinate, often accompanied by a burning sensation, even when the bladder isn't full. These symptoms often mimic a urinary tract infection, leading to misdiagnosis or unnecessary antibiotic use. Treating the underlying infection usually brings rapid relief from urinary symptoms. It's also important to identify triggers, like douching, antibiotic use, or tight clothing, that may disrupt the vaginal flora. If you're dealing with both vaginal and urinary symptoms, a simple test at your doctor's office can determine the exact cause and get you the treatment you need. 6. Weak bladder or overactive bladder syndrome. An overactive bladder is a condition where the bladder muscle contracts involuntarily, creating a sudden and urgent need to urinate, even when the bladder isn't full. This leads to frequent bathroom visits, sometimes accompanied by leakage if you can't get there in time. Overactive bladder syndrome can be caused by several factors including aging, bladder nerve dysfunction, pelvic floor muscle weakness, and underlying neurological conditions. In some cases, the cause is unknown. For those affected, the constant urgency can disrupt daily life, interrupt sleep, and cause anxiety around social or work settings. Treatment for overactive bladder syndrome includes bladder training, pelvic floor exercises, dietary changes, and in some cases, medications or nerve stimulation therapies. Recognizing the symptoms early and seeking medical advice can help prevent the condition from worsening and restore your confidence in daily life. 7. Urinary tract infections. A urinary tract infection is one of the most common reasons why people, especially women, experience frequent urination. It occurs when bacteria, most often E. coli, enter the urethra and multiply within the urinary system, typically affecting the bladder or urethra. One of the hallmark symptoms of a UTI is the sudden, urgent need to urinate often, even when the bladder is nearly empty. This frequent urination is often accompanied by a burning sensation, pelvic discomfort, cloudy or strong-smelling urine, and in some cases, blood in the urine. The inflammation caused by the infection irritates the bladder wall, making it hypersensitive to even small volumes of urine. This causes the bladder muscles to contract more frequently, even when they don't need to. Though UTIs are more prevalent in women due to their shorter urethras, men can also experience them, particularly if they have an enlarged prostate or kidney stones. Left untreated, UTIs can travel to the kidneys, becoming more serious. Fortunately, antibiotics typically clear the infection quickly, and increasing water intake can help flush bacteria from the urinary system and prevent recurrences. 8. Diabetes. Frequent urination can be one of the earliest and most noticeable signs of diabetes mellitus, both type 1 and type 2. When blood sugar levels are abnormally high, the kidneys work overtime to filter the excess glucose out of the bloodstream. This process pulls more fluid into the urine, resulting in polyuria, the medical term for excessive urination. In people with uncontrolled diabetes, this constant filtering causes them to feel the need to urinate every hour, and sometimes even multiple times during the night. This can lead to dehydration, which paradoxically increases thirst, creating a cycle of drinking and urinating that's hard to break. Alongside frequent urination, other signs of diabetes include unexplained weight loss, fatigue, and blurred vision. Managing diabetes through diet, exercise, and medication can bring blood sugar levels back under control, reducing the strain on the kidneys and decreasing urinary frequency. If you're peeing a lot and also feeling unusually thirsty, it's crucial to get your blood sugar levels checked, as early detection can prevent long-term complications. 9. Enlarged prostate, or benign prostatic hyperplasia. For men over 50, frequent urination, especially at night, is often one of the first signs of an enlarged prostate, or benign prostatic hyperplasia. The prostate is a small gland that surrounds the urethra just below the bladder. As men age, the prostate tends to grow larger, and in doing so, it can press against the urethra and partially block the flow of urine. This obstruction doesn't just slow the stream of urine, it also prevents the bladder from emptying completely. As a result, the bladder becomes overactive and starts contracting even when it's not full, leading to more frequent trips to the bathroom. Men with enlarged prostate may notice they have to strain to start urinating, experience a weak stream, or feel like they can't fully empty their bladder. While BPH isn't cancerous, it can greatly affect quality of life. Treatments range from lifestyle changes and medications that shrink the prostate or relax the muscles, to surgical procedures in more severe cases. Getting evaluated early can help prevent complications like urinary tract infections, bladder stones, and even kidney damage. 10. Medications. Many people are surprised to learn that the medications they take could be the very reason they're visiting the bathroom so often. Diuretics, commonly known as water pills, are the most obvious culprits. These are prescribed for conditions like high blood pressure, heart failure, and certain kidney disorders, and they work by encouraging the kidneys to remove excess salt and water from the body through urine. Other medications that can increase urination include certain antidepressants, antihistamines, sedatives, and drugs used to treat bipolar disorder or muscle spasms. Some medications interfere with bladder control by relaxing the muscles or irritating the bladder lining, while others may indirectly cause frequent urination by increasing thirst or fluid retention. If you've recently started a new medication and noticed a change in your urination habits, it's worth discussing with your healthcare provider. In some cases, adjusting the dose or switching to an alternative drug can help resolve the issue without compromising your treatment. 11. Dietary factors. What you eat and drink can significantly impact how often you need to urinate. Caffeine, found in coffee, tea, energy drinks, and chocolate, acts as a diuretic and bladder irritant. Alcohol has a similar effect. It suppresses antidiuretic hormone, ADH, which normally helps your kidneys conserve water, leading to increased urine production. Spicy foods, artificial sweeteners, citrus fruits, and carbonated drinks can all irritate the bladder lining and increase urgency in some people. Even seemingly healthy foods like tomatoes and pineapple can trigger symptoms in sensitive individuals. Keeping a food and symptom diary can help you identify potential dietary triggers. In cases where frequent urination is not caused by an underlying medical condition, making a few simple changes to your diet may be enough to bring things back to normal. Frequent urination isn't just an inconvenience, sometimes it's a message from your body. The key is knowing when to worry, and when it's just too much coffee. If you found this video helpful, please give it a thumbs up, share it with someone who might need it, and hit that subscribe button for more in-depth health content like this. Your health matters. Stay curious, stay informed.